Hey guys, welcome back to the Friday Q&A. I forgot to run my dishwasher last night and told her I was taking a shower, so I have my biggie mug getting me through this Friday morning, but I hope you all are doing well. And welcome back to the Q&A. The past few Q&As were on topical clindamycin and topical Axone for acne, and those Q&As generated a lot of enthusiasm, as well as some of my other videos recently about dark spots and hyperpigmentation generated more enthusiasm for a video on the topical cream azelaic acid, or the topical drug azelaic acid. So many of you have been advised to use this either prescription or in an over-the-counter form for hyperpigmentation, melasma, acne, rosacea. There are many conditions that azelaic acid can be helpful for, so I have many questions that you all have been asking me about. So I thought I'd do an entire Q&A about azelaic acid today. If you're new here, welcome. My name is Andrea and I'm a dermatologist. I film fun vlogs of my life and share them here on YouTube. And I also film a variety of skincare related videos talking about various dermatologic topics of interest and skincare routines, skincare product reviews. So if that type of thing is at all of interest to you, then subscribe for more. But anyways, what is azelaic acid? Well, there is a little yeast that naturally lives on everyone's skin called Malassezia furfur. And it turns out this little yeast makes a compound called azelaic acid. Azelaic acid is a natural acid that is on everyone's skin. It is referred to as a dicarboxylic acid, and it can do actually a lot of things for the yeast and for our skin. Okay, so it can, first of all, calm down inflammation in the skin. It can calm down the inflammation that is triggered in our skin when ultraviolet light hits the skin. Specifically when the rays of ultraviolet light that include UVB hit the skin, normally there are a lot of inflammatory cytokines, they're called, or little messengers that incite inflammation. Those are normally released to lead to redness and discoloration, skin aging, and this little acid, azelaic acid, can suppress that. It also has an affinity for abnormal melanocytes, which are the cells in our skin that make pigment. It has an affinity for abnormal melanocytes, and it targets and suppresses the enzyme tyrosinase within those abnormal melanocytes to put the brakes on hyperpigmentation. So it is helpful for hyperpigmentation. And then furthermore, it's also antimicrobial, okay? So it can lower the amount of bacteria on our skin, and it can actually help to get rid of the bacteria that is responsible for a part of acne. Formerly, this bacteria was referred to as Propionibacterium acne. It has now been rebranded as Cutibacterium acnes. Someone pointed that out in a recent video of mine. I've been continuing to call it P. acnes just to not confuse anybody, but do know that he's been rebranded as Cutibacterium, so he's got a new name, but same little devil. Anyways, azelaic acid can suppress the amount of Propionibacterium in our skin, so you can imagine it can be helpful for acne. And azelaic acid can also help to suppress skin cell hyperproliferation that leads to plugging up of the pores. So it can be useful in unplugging pores. And therefore, given all of these things that azelaic acid can do, it has since been refined and compounded into creams and vehicles to be applied topically to the skin to treat a variety of skin conditions. It is available in a 20% cream by prescription called Azelaic. It is also available in a 15% gel called Finacea, and now recently we have it in a 15% foam. Let me just get another sip in here. Because azelaic acid is an all-natural compound that is already present on our skin, It is very safe. It is safe in pregnancy. In fact, one of the few topical medications that we have that we feel very, very confident is completely safe in pregnancy and is often utilized during pregnancy to treat conditions like acne, rosacea, and melasma. Hyperpigmentation can be very helpful in those conditions while the woman is pregnant, and is very safe. Some of it is absorbed, but with no adverse effects to human health. So some of it is absorbed through the skin, but it's already on our skin. You know, our bodies are more than capable of processing it. It's very, very safe. No adverse effects to human health. As far as putting it on the skin in these creams and gels and foams, what can you expect as far as side effects? For the most part, this cream can be very irritating, unfortunately. It can be very drying. I think one of the things people most commonly complain about, at least to me in my experience in prescribing it and having people using it over the counter, is actually a little bit of itching. And the other thing that, you know, you can have is some dryness and peeling. Some people find it stings. And for the most part, if the individual is able to keep calm and carry on, continue with it, despite these effects, they tend to resolve after about 4 weeks and things start going okay. People with acne will of course ask me, is my skin going to purge, quote, purge while I'm on this? Purging, or this, you know, fear around skin purging and acne in particular with topical medications is, you know, kind of overemphasized on the internet, I'll just say that. And for the most part, really what they're talking about is just irritation and dryness and peeling that happens when you first start taking it, not necessarily worsening of the acne. True, sometimes the acne can surface a little bit more extensively in the first few weeks of starting any topical medication for acne, but I think they're really overemphasizing that in the internet forums. It's more of an irritant dermatitis, and if you are getting some dryness and peeling from topical azelaic acid, you know, you may perceive that as purging, but it's really just some irritation, and as I mentioned, it tends to subside after 4 weeks. How does it work in acne? Well, if you'll recall back to my acne talks, there are a variety of things that dictate the pathophysiology of acne. First of all is abnormal proliferation of the skin cells leading to plugging up of the pores. Secondly is inflammation in the skin leading to those inflammatory red bumps. Third is the little bacteria in the skin called P. acnes who can kind of get too comfortable in that plugged up pore and drive some of that inflammation. Then you have the contribution of the oil gland or sebum dumping into that plugged up pore and just kind of creating more inflammatory mediators for the P. acnes to digest, and that's how you get a red bump. Now, on the outside of all that, you also have some hormonal influences that drive hormonal acne, and those hormonal influences are pushing the gas pedal on that oil production. Okay, so remember that biology of acne there. What can azelaic acid do to address those components? Well, it can guide the skin cells to tone down their rate of division so the pore doesn't get plugged up as much. So in other words, it can be helpful for plugged up pores. It can calm down inflammation, so it can be helpful for some of the red bumps of acne. And it is bacteriostatic and reduces the amount of Cutibacterium or P. acnes in the follicle. So it addresses those things. It does not, however, affect the rate of oil production. It does not influence at all the biology of hormone signaling to the oil gland. So the hormonal component of acne is not going to be addressed, and the oiliness component of acne is not going to be addressed by azelaic acid. But it is pretty useful in acne. I would say it's pretty useful in acne that is mild to moderate, and the studies show that it does as good a job as 5% benzoyl peroxide, as 0.05% tretinoin, and it does as good of a job as various topical antibiotics that are often prescribed for acne. And it does better than just placebo. So it's helpful. It's obviously not going to be helpful for all types of acne, so it's not going to address that hormonal component. When can you start seeing improvements in acne? It generally takes about 1 to 2 months of consistent use of azelaic acid before you start seeing improvement in the acne, so that's kind of a while to wait, and people often get impatient, particularly if they're itchy from it in the first month. It takes a while to start working. And you really see maximal outcome at about 4 months of continuous use. It can be used twice daily. However, it can be used 3 to 4 times daily, and it's thought that if it's used 3 to 4 times daily, particularly on top of some of the inflamed lesions of acne, some of the red bumps, it can increase the penetration of the azelaic acid to those lesions and amp up the efficacy of the azelaic acid. So that is one way that it can be used. Now, the second condition that azelaic acid is often prescribed for is rosacea. How does it work in rosacea? Well, it largely works by calming down some of the inflammation that drives rosacea. As I mentioned, it can lower the amount of inflammation that is kicked off when our skin is exposed to ultraviolet light. If you suffer from rosacea, sun protection and avoidance of sun exposure and UV exposure is key to preventing a flare of your rosacea. If you go out in the sun, I mean, that can really kick off a bad flare. So those inflammatory mediators are suppressed to a certain extent by the azelaic acid. While rosacea is not a bacterial disease, some of the bacteria that naturally live on our skin, they can release some little inflammatory mediators. Some of the pathobiology of people with rosacea is such that it's thought to be that those inflammatory mediators, their skin is just a little bit more sensitive to it. So it's thought that the azelaic acid, with its ability to lower the bacterial counts on our skin, can also help people with rosacea, kind of by virtue of that. But it's not really clear at this point, but it's one theory as to how azelaic acid works. How good is azelaic acid for rosacea? It's helpful for certain components of the rosacea, certain subtypes of the rosacea. So if you've got rosacea, you know that there can be background redness. I have a whole Q&A on rosacea, by the way. There's background redness, and then there can also be inflamed red bumps, kind of look like acne but are not acne. So the azelaic acid can be really helpful for the bumps. They're called papulopustules. Red bumps are papules. Pustules, or if you have, many people call them whiteheads, but they're just little white pus bumps that can occur in rosacea. Azelaic acid can be very helpful in reducing the amount of the number of those lesions. The background redness, however, it can help a tiny bit, but it rarely ever completely gets rid of the background redness of rosacea. So if you have persistent redness at baseline from your rosacea, using azelaic acid may improve the appearance of that, but it's not going to get rid of that. I talk more about treatments for that in my rosacea Q&A, but azelaic acid will help a little bit for that, but not completely. Now, what can you expect as somebody with rosacea as far as improvement with azelaic acid? I think for rosacea patients in particular, they're more sensitive to, obviously, the irritation and stinging from applying it. So for you, the vehicle tends to be very important. In other words, some rosacea patients do much better with the gels than the creams. The newer foam, however, seems to suit rosacea patients really well. It's very gentle, very well tolerated for rosacea patients, and they tend to be able to tolerate it the best. Interestingly, with the new foam, the studies show that the foam, people are obviously able to comply with the foam better. It's very effective for rosacea, but in some of the studies, they looked at, the azelaic acid foam, and in comparison to just placebo foam, so the exact same foam with no azelaic acid, and the azelaic acid containing foam obviously got the people much better, but foam, the moisturizing foam alone got people better. So that's interesting. We already know some of how rosacea maybe worsened has to do with barrier barrier problems. So that foam vehicle that the newer foam is formulated in seems to be really moisturizing and, you know, helpful for the skin barrier of people with rosacea. So, you know that as somebody, if you're somebody suffering from rosacea. And within the family of rosacea is actually another condition that many of you suffer from, and I have a Q&A about, called perioral dermatitis. And there are some studies to show that azelaic acid can be helpful in perioral dermatitis as well. So perioral dermatitis is kind of in the family of rosacea, but slightly different, and azelaic acid can be helpful for that. Now, the other subset of people who are going to be using azelaic acid or interested in it are those of you with melasma or post-inflammatory hyperpigmentation, dark spots, maybe some sunspots that you're trying to brighten. You may be interested in azelaic acid as well, and it can be very helpful for those conditions because azelaic acid has an affinity and concentrates in abnormal melanocytes, so the skin cells that are making pigment to a more robust degree and contributing to the dark spots. Azelaic acid is going to zone in on those, and it's selective for those, and it ignores all of the normal melanocytes around it. So it's great in that, unlike hydroquinone kind of hits everybody. And as I mentioned in my hydroquinone videos, hydroquinone can result in some rebound hyperpigmentation when it's stopped because it's affected some of those normal melanocytes. But azelaic acid is not going to do that. Azelaic acid will not affect the background normal skin. So it's more selective for the abnormal melanocytes. It's not as robust an outcome as hydroquinone, but it can be very, very helpful. And people often feel more comfortable using it because it's, you know, part of our natural skin biology already. It's obviously safe in pregnancy, whereas hydroquinone is not. It's pretty good. Using a 20% azelaic acid cream, for example, twice a day will get people pretty good improvement around about somewhere around 24 weeks. So, you know, again, it takes time to see results. Azelaic acid has been compounded in a variety of, you know, ways with other things to increase penetration. One such product that is available over the counter that I'm a fan of and have talked about on here before is the Glytone Enhanced Brightening Complex, which is Glytone's glycolic acid and azelaic acid. Glytone, I'm very confident in their glycolic acid formulations. I feel as though they know what they're doing. That's just my personal bias. So not only will it zone in on, you know, the abnormal melanocytes of melasma, post-inflammatory hyperpigmentation area, so dark spots that result from healing acne, but some sunspots that can fade as well. I will caution you this, however. If you are somebody who has a dark spot or dark spots that you think are just sunspots, I would strongly encourage you, before, you know, getting an over-the-counter azelaic acid and self-treating them, I would strongly encourage you to see your healthcare provider first and have a skin check. And the reason is this. Azelaic acid, as I said, has an affinity for abnormal melanocytes, and that includes precancerous melanocytes, okay? So precancerous and cancerous melanocytes. So what you should be aware of is that because azelaic acid has an affinity for abnormal melanocytes, there are certain subtypes of melanoma, namely lentigo maligna melanoma is a subtype of melanoma, which if you are putting azelaic acid on, it will lighten a lentigo maligna melanoma, okay? And so if you are sitting at home, you know, watching YouTube videos and you know, you're self-treating what you think is a sunspot, and it's getting brighter, it's getting lighter with over-the-counter azelaic acid, and you're feeling good about it, you know, I would caution you this. Lentigo maligna, a subtype of melanoma, can be brightened by this, and you don't want to delay a diagnosis of it with this false optimism that you're improving it with the azelaic acid. So I would say as a starting point, for sure, before plummeting into self-treating dark spots, hyperpigmentation, you get a skin check and you make sure that what you're dealing with is understood and not assumed, because you don't want to end up in a dangerous situation where you've been self-treating a melanoma. You can't self-treat that. It's a deadly diagnosis and it should be caught early versus late, and you don't want to delay a diagnosis of melanoma. So overall though, Azelaic acid is very safe, very effective, pretty easy to tolerate, pretty gentle despite the itching and irritation that can occur in the first 4 weeks. Safe in pregnancy, can be combined with pretty much any other active ingredient without compromising the active ingredient or the azelaic acid. And you know, can really get people some good additional benefit. But I think what you should understand, regardless of what condition it is that you've been advised to use this for, is that it's not going to happen overnight. Azelaic acid takes its sweet time. You have to be patient with it and keep calm and continue on with it before you really start to see much of a result, if any. So, but anyways, guys, I hope this video was helpful to you all. Thank you so much for all of your insightful questions. It makes filming these videos very easy for me. So if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow.